So welcome, everyone. My name is Ann Phelan, and I am the Manager of Resources and Engagement at the Transition Center at Perkins School for the Blind. And I'm joined by my colleague, Janine Brennan, who is the Manager of Content and Communication. Before I introduce our special guest, I just want to welcome you all and thank you for being present today in our community. When we come together in a supportive way by sharing and listening, we really grow. And having a growth mindset is really going to be the key to successful transition planning. So wherever you are in the stage of transition planning, wherever state you're from, whatever your situation is, tonight is meant to bring information that's going to be cost saving, informative, and helpful as you start to think about later after 22 or 21. So without further ado, with great gratitude, I want to introduce my colleague, and her name is Amy Weinstock. And Amy, you and I have been working together for over 15 years in collaboration and also in my role working with you and your family. Amy is the director of the Insurance Resource Center for Autism and Behavioral Health at UMass Chan Medical School, Eunice Kennedy Shriver Center. So Amy is going to be presenting a dynamic talk. We encourage you throughout to please type in your questions, suggestions, feedback, or anything you want to say in the chat box. And I will be moderating it. And as I need to, I will be interrupting Amy once in a while if it feels right. And we'll also have time towards the end. We have allowed 1 hour for our evening format, and the recording will be made available. So without further ado, Amy, welcome. And thank you so much for being here.
Thank you. Welcome, everyone. So I'm going to be speaking about insurance considerations for transition age youth and young adults. And, I love the keeping the wheels on the bus analogy because that kind of feels like where we are all the time. I am the parent of a 26-year-old daughter. So a little bit on the other side of the turning 22, but still feel like we're in transition. Next slide, please. So we have about 3 hours of material to go through tonight in an hour. I'm going to give an overview and some background of how I came to do this work and what we do at the Insurance Resource Center. If there's one or two key takeaways for you, just remember for those of you who have, transitioning age children who are, in their teens and early 20s, that all children can stay on parents' private insurance policies till age 26, but disabled dependents can stay on a parent's policy past age 26, usually for as long as they're going to have that. So I'm going to talk a little bit more about that, but if you just get one takeaway, because some of this is going to be like a fire hose, that's probably one of the most key things. And you need to do it before they turn 26, though. I will talk about Social Security only in how it affects coverages. I will not be talking about Social Security because that's kind of way out of my wheelhouse. And then I'm going to be talking about a Medicaid program called Premium Assistance, which is available in Massachusetts and several other states, but I know many people are here, and I call that the best kept secret, but that's one of the other pieces that affects things and can sometimes become a pretty big part of someone's supports as they're transitioning and turning 22. So if you could go to the next slide, please. So this is not a quote that I came up with. There's a psychologist, I believe, named Peter Gerhardt, who's been working with adults before there were a lot of adults with autism. I remember first hearing him speak when my 26-year-old daughter was very young. And he just has a great presence, a booming personality. And he shows this slide that takes the African proverb, it takes a whole village to raise a child. And then he says in this big booming voice, but to raise a child with autism, or I think other disabilities, to be an employed, included, safe and productive adults, take something like a village, 2 small towns, a mid-sized city, a chapter of the Hells Angels, half a dozen communes, a large trailer park, an on-call medical team, and a fleet of vehicles. And we can all chuckle, but it's really not that different. So, if you're feeling a little overwhelmed by all of this and not quite sure, it's not you, it's that this is a tough process, and the transition is one of the tougher times in our children's lives. And then if I can put my work into context, I like to think of, my work in insurance and the Insurance Resource Center as a chapter of the Hells Angels. Don't tell that to the people at the medical school, but that's kind of where we feel like we play. Next slide. So just my family's journey, how I got here. This is not something I ever thought I'd sort of do when I grew up, but Elena was diagnosed with autism in 2000. And I quickly learned, as was written in the New York Times in 2004, that no disability claims more parental time and energy than autism. And this cartoon, which I found out, was that unfortunately, you have what we call no insurance. So that was my condition. Insurance covered a visit where we got the diagnosis, but after that, we were sent to our school for services, and something seemed wrong with the system. I was fortunately in 2000, they had come far enough with the science to know that autism was not some mental disorder that was caused by quote unquote refrigerator mothers, which was the prevailing belief maybe a generation before. They knew it was neurobiological. They were starting to have treatments with evidence and efficacy, but insurance just carved out, most insurance, any kind of coverage for that treatment, as well as many other mental health treatments. So it struck me as wrong, but I was really focused on, getting my daughter the help she needed and trying to figure out this new normal life, and, sometimes just getting out of bed and putting one foot in front of the other every day. So, but I was working at the time in thinking on the regulatory risk management side. So if you go to the next slide, please. I decided a few years later to leave the workforce, as many people do, and pursue maybe that work-life balance with a little more balance for my daughter. If any of you are thinking of trying that, it's a myth, but I figured since I was going to have so much time on my hands, maybe I could apply some of my experience in financial regulations and risk management to do something about the lack of insurance coverage. So I came actually in 2005 to the Shriver Center at the medical school, and I did a one-year fellowship called Leadership Education in Neurodevelopmental Disabilities, where I learned all about health policy, Medicaid, Medicare, advocacy systems, et cetera. That was, great foundational knowledge for the work that I was hoping to do. And then as part of that program, we had a independent research project, and mine was expanding insurance coverage for autism treatment. And lo and behold, that became the blueprint for the law that was passed in 2010. That was the first law of several requiring insurance to cover treatment for autism. So when they make the movie, they'll explain that, I was this kind of rookie advocate with really not much grounding or basis in that world. I, had this idea. I wrote a paper. I took the subway to Park Street, went to the State House and got a law passed, and they'll probably get somebody much prettier than me to play this, but things don't actually happen that way. And we don't really have too much time to talk about that, because I really want to talk about how insurance works. But in this paper, at the end of it, I did come across some quotes that I thought were kind of apt, and actually I didn't realize quite how appropriate they would be for what I was going to subsequently end up into, because I had no vision or expectation it would lead to this. And the quote is, leaders are visionaries with a poorly developed sense of fear and no concept of the odds against them. And that's from Dr. Robert Jarvik, who invented the artificial heart. So what I have here are some pictures from, the late 2000s of the fearless leaders. There's Governor Patrick and Senator Barbara Italian and Larry Kenkro from the Red Sox. You're going to see more of them in a video. And then this wonderful little boy whose mother brought him to the State House. We passed this law with no budget. We everything was contributed in kind. We chipped in and spent a little bit of money to get some little stickers printed with the got milk font, got insurance, not if you have autism. And we, stuck that on anyone who came close enough to us. And I didn't realize until I blew this picture up to take away the child's face, the shirt that his mom had put him in that day, which was just so appropriate, of the wild things making mischief. And then I lived in that red t-shirt for a while at events, and my hair 15 years later is the same color, but it takes a lot more chemicals. And I don't think we have time tonight. I don't usually wear pearls in a t-shirt. There's a story about how that happened. It was not expected, and I never knew this was going to be like the picture of the advocacy from the time, but there we are. So I call it the fearless and the clueless, and we'll go to the next slide and we will show you what happened.
Some insurance companies are not happy, but the parents of autistic children were cheering at Fenway Park today. They called it more exciting than a playoff series. The governor signed a bill forcing insurers to offer a full range of coverage.
And News Center 5's Pam Cross is live at the ballpark tonight, where advocates are calling this, Pam, landmark legislation.
They do call it landmark because it covers a variety of medical services for a number of ages. They held it here at Fenway because a member of the Red Sox family is an autism advocate, and supporters say the governor and the legislature hit this one right out of the park and over the green monster. They waited a long time for this.
Both my husband and I are school teachers. We work 2 and 3 jobs to pay close to $15,000 a year just for things that our insurance company won't pay for.
They filled a section of Fenway Park to say thanks. The law requires insurance companies to provide coverage for all forms of autism. It affects the 10,000 Massachusetts residents with autism, both children and adults. Advocates believe the state will save money.
Either the families are going bankrupt taking care of their kids, or the kids aren't getting the care, and the payer of last resort is the state.
So this is for Amy and Jack and Elena and Mary Catherine and George.
With their adult autistic son watching, one of the bill's sponsors named the children of those who worked for 2 years to change the rules. They got a salute from the governor.
You are the reasons why, no matter what else was before the legislature, this issue and your needs would not be forgotten.
Someone had said it's a home run, I think the mayor said, but actually to me, it's the bottom of the ninth, and somebody had a grand slam today for autism.
In fact, they're probably looking for some grand slams tonight. Business says that this is a bad idea, that it will push up premiums for everyone, but with the numbers of autistic children growing each year, others say the law is real relief. Reporting live from Fenway Park, I'm Pam.
So there is a question about whether similar laws have been passed in other states, and the short answer is yes. Massachusetts was, I think, the 23rd state to pass legislation starting in about the late, like 2007, 2008. Ours was passed in 2010. And by the end of the following decade, virtually every state has requirement for private, and then Medicaid began covering it. And in every state, the laws are slightly different, and Massachusetts had one of the more comprehensive laws. There are still some limitations on some. There's a lot of limitations on Medicaid or age limitations, but so yes, it is in most other states. So we, but it was pretty spectacular that it passed. It passed with unanimous support. It passed in the first legislative session that was filed in, which is not usually how things work. And that had to do with a lot of other factors besides the charm, persuasion, grit, and determination of our group of strong advocates. But it was system changing, because before that, these treatments had never been covered. But when something like this happens, and naively, I really thought like we were done and I was going to go back to pursuing that work-life balance. And what we realized pretty shortly thereafter was the work was just beginning, because the implementing a law like this, where it's requiring coverage for treatments such as ABA therapy that have never been covered by insurance before. There's no licensed providers. There's no network of providers. Things in insurance world that I've learned, like CPT procedure codes for billing these therapies, didn't even exist. And just things that might be much more straightforward when you have a condition that's treated with an office visit or a, X-ray or a prescription are not straightforward, like copays, when you have a therapy that's delivered multiple times a week, a day, in a home, in the community, in other settings. So just a lot of questions, and it really became something that was more than our very effective group of advocates could do out of our little kitchens, offices and home offices, and what we were doing. Of course, we realized we had to do that again 10 years later during COVID, but we needed more infrastructure and more resources to support the implementation of this and provide information for the community. So shortly thereafter, the Shriver Center at the UMass Medical School, where I had done the research originally, and I was very proud of that, and it was really wonderful, decided to establish the Insurance Resource Center, which was really a wonderful, great resource because it gave us the infrastructure. And I like to say, there were people who could answer the phones, and there were copy machines and a website, but a resource where we could kind of set up an operation to provide the information and assistance for the community in implementing this law. And I have mentioned that there are similar laws in many states. There are not insurance resource centers in other states, and Massachusetts has had one of the more robust implementations. And I think it is because of some of the work we've been able to do, and the dissemination and the assistance and the impact. So we have 4 main functions. Anne has posted our contact information in the chat. It's also on this slide, and it'll be at the end, with information technical assistance, assistance with all kinds of issues, including, we get a lot, and many people here are saying they're from Massachusetts. Mass Health is the Massachusetts Medicaid program. And even though this law I just talked about was private insurance, Medicaid now covers similar treatments, and we do a lot of work, and Medicaid can play a role as secondary insurance for people. We have a great website with lots of documents and great fact sheets and other relevant information. And then we do a lot of trainings and webinars on these laws and topics, and ours are recorded and posted on our website. So if there was a specific topic, we have one in particular on keeping a disabled dependent on a parent's policy, you can go to the website and get copies of those and look at those. And you can go to the next slide, please. So as I said, we help the whole community. Majority of our calls, and we help thousands of people each year now, with our families, with information, technical assistance. Many people apply for Mass Health, or they obtain it in their transition to adulthood through Social Security, or they apply for it as secondary insurance. A lot of resources, troubleshooting. We help providers. They needed as much assistance in how to do this. And we do have some specialized trainings for providers and clinicians. And then what has also been really good is, because we are a kind of centralized resource, and we get so much questions and concerns, and won't be surprising to know that people don't call us to just tell us things are going well. They call us when they have issues. We take the information that we get from those individual calls, and we can see trends that maybe if one family is struggling with something, it might not be as a parent. And when we see something that looks like it's a trend, it looks like it's a problem, we take that and we bring that to people, and can be pretty effective in getting it fixed. So just, this week we've come across this weird little thing in Mass Health that we've never seen before, where people in a certain category of coverage are getting their coverage automatically terminated by the system, and it just doesn't make any sense. And, that's the kind of thing, if you're one family and it happens to you, you wouldn't quite know what to do with it. And candidly, we still don't quite know what to do with it, but we've seen enough to say, this is potentially a problem. And, we have good, close working relationships and have people looking into that to see if something changed and needs to be addressed. Next slide. But in layman's terms, everybody here, we hope, has an insurance card with coverages. There's lots of things on there. There's nothing that says how you are going to get coverage for, say, autism treatment, or maybe even speech or other kinds of behavioral health treatments. And then there's lots of regulations. And to make it even more confusing, two people on tonight's presentation could have exactly the same insurance card, but it's actually subject to different laws and regulations. So we help people understand what their insurance covers, whether it covers what they need. If it doesn't, whether there are other ways to obtain either supplemental coverage or get to that. I do want to back up and say, this work started with autism insurance. And for the first decade until about 2020, maybe 21, we focused on autism insurance. But, some of these issues that we see, like with Medicaid and Mass Health and the transition of children to adulthood with disabilities, don't just apply to people with autism. And we were always willing to help people. But in 2020, we expanded more formally at the request of some of the state agencies with some funding, and expanded to be the Insurance Resource Center for Autism and Behavioral Health. So we can help people with a much wider range of disabilities. And we don't get I'm so sorry, I'm having this problem and my child doesn't have autism, but can you please help me? So we can help anybody with the issues, and we're happy to do that. And what we also did with that expansion, we brought on several additional team members. We're still a very small center, but we expanded our capacity significantly, and we expanded the depth of what we can do, particularly within the Medicaid system. So we've always worked closely, and when we had issues, we could work with partners to get the information we need. And now we're able to bring much more of that in-house. So we have people who can find out the information a little more directly and help people more directly with resolving things in those systems. And we also expanded our abilities to help people with different languages and capabilities. So we are able to, we have in-house people who speak Spanish and Portuguese, and then we have access to interpreters and services to help people from other languages as well. Next slide. So the key point of keeping people on dependence policy. So if you want to just leave after this, you can. So under the Affordable Care Act, which, fortunately drew a lot of political debate and became a little, I think, politicized. But one of the things that really wasn't seemingly controversial and that most people embraced as a pretty good thing was it allowed children to remain on a parent's policy until age 26. Disabled dependents can usually remain on a parent's policy past age 26. It was left up to individual states, but I believe it's about 41 states, and then there's federally regulated plans, but it's very few plans that don't allow that. However, in order to do that, parents need to apply to their employer or to the insurer, and we advise you to do that well before the dependent turns 26, because after they're 26, they can't be added back, regardless of the disability. And it's a pretty hard and fast rule. 26 in a day, you really can't get back on this. So when someone is transitioning, especially, in the 18 to 22, there's so many issues and concerns, and you're dealing with, school ending and adulthood and all the issues that go around that. People don't really think about this, and you don't have to think about it at 22. But you want to start thinking about it at 24, 25, and make sure you don't miss that 26 age cutoff. Next slide. So, the questions that we get are, does this apply just to people with autism? And no, it's all disabilities. If a child has a job that provides insurance, or you don't think that needs that, oh my gosh, my Zoom just went out. You can't, as I said, you can't add them back if they're over 26. So we really advise that people try to keep them on if possible. And if your child's older than 26, you can always check with your employer and see, but it's very rare that someone will get added back. Someone asked if this is Massachusetts specific or national. It is pretty broad. As I said, it's mandated in over 40 states. And then, even if it's mandated in a state, if your policy is a federally regulated policy, which about half of people with policies are, it's not. And somebody asked, what about SSI? Can they get Medicaid with SSI? So a disabled adult can get Medicaid sometimes via SSI and sometimes just by applying for Medicaid. And you can still have private insurance, and you can still stay on your parents' policy if you have Medicaid, and even Medicare. And so there's some comments, and I'm going to answer these questions now. A good idea to keep on a parent's policy and turn down the loved one's employer provided insurance. Well, just know that they can't go back. It can be a little complicated because what the insurers use, there's lots of, it's not a difficult process relative to applying, say, for Social Security or some of the other benefits that you have to apply for. It's usually a kind of one-page form that a family fills out, and then there's another form that the doctor fills out. And every insurance company does it a little bit differently. Some just approve it, some approve it and say they want to review it in a few years. But it's not a hugely onerous process. However, their definition of disability is not capable of, it's kind of related to the Social Security, gainful employment, sustaining employment, self-sustaining employment, and a job with an employer that's offering employer-sponsored insurance might raise some questions about, is this really needed, or your child may have a diagnosed disability, but maybe they're not needing this. We do know of adults who are working who are still on their parents' policies. So it's definitely something you want to look at, and you might want to contact our center for more advice about that. When you say apply, do you mean something more than adding the individual as a dependent? So what happens when a person is turning 26 is usually get a letter from your insurance company about 30 days before they turn 26, telling you that they are going to be off the policy when they turn 26. So, you can have them on the policy, but you have to apply for, it's usually called disabled dependent coverage, to keep them on the policy past age 26. And don't wait until 30 days before. Try to do this 6 months to a year before they're turning 26. If there are no more questions, we'll go to the next slide. So now I'm going to get way out of my comfort zone and really just talk about Social Security like 101. And I hope as part of this series, you have people who know much more about Social Security talking about it. So this is not about how to apply for it, how to get it, and what happens. But there are two kinds of Social Security, and there may be more, but we know of two. And even though they sound pretty similar, SSI versus SSDI, they're really quite different benefits, and they affect insurance differently. So SSI is Social Security for people who are, incapable of working. It's based on financial need. A person can't have more than $2,000 of assets. And when Social Security looks at that for individuals under 18, they look at a household, and then individuals over 18, they look at the individuals. So when you learn about financial planning for special needs, a lot of planners, work with families to make sure that if your child's going to need Social Security, and relying on that, by the time they turn 18, you want to make sure they are eligible with that, and the resource limit of $2,000. There is legislation to raise that because it's been that way for decades. And, many children might be disabled and they really don't have the potential to be earning self-sustaining incomes and whatever, but they may have savings bond from grandma, and they have more than $2,000. And in Massachusetts and many other states, but not all other states, when you apply for SSI and you get approved for it, you automatically get Medicaid as Mass Health. In other states, you might not automatically get that. I know there's someone here from New Hampshire, and I think New Hampshire is a state where you might not get that. But in Massachusetts and many other states, you get that. And it doesn't matter. You can have your private insurance. You can keep your private insurance. But there are things you need to do when you get that. And I'm going to, if you have private insurance, and I'm going to explain that. And then SSDI is a different benefit. That's based on someone's work history. If it might be a person who's working and then they become disabled and they're paying into Social Security, or it might be a disabled child of an adult, like a parent who retires or is deceased, and the parent is collecting Social Security based on their work record. And then the disabled child collects SSDI based on the parent's work history. It's like a percentage of that. And for SSDI, there usually aren't resource limits. However, in the crazy adult system, depending on what kind of benefits this disabled person's getting, you still may be subject, but not for SSDI. And with SSDI, you don't get Medicaid, but you automatically get Medicare 24 months after you start receiving SSDI. That doesn't mean you can't be eligible for Mass Health. You would just have to apply for it. And there's lots of people who call our center and say, I don't know, I get Social Security, I don't know what kind I have. So if you don't know what kind you have, SSI is paid on the first of the month, and SSDI and Social Security for like retired people, it's any day but the first of the month. So that's about all that I know. And then there's somebody who's making some really great comments in the chat about SSDI, and I'm not sure we'll be able to cover that, but I would advise people to look at that because it's really helpful.
Amy, I just want to jump in. I put it in the chat box. We have one of our guests is a professional this evening, Lydia Sheehy, who will be presenting at our in-person event May 11th, all about benefits. I realize some of you are not able to come to Watertown, so feel free to reach out to Lydia. She has a wealth of information. And Lydia did have a question about her daughter who's on her COBRA policy right now, Amy. And Lydia's going through open enrollment at a new employer, and she's wondering, is there any tips on getting her on the new United Healthcare policy during open enrollment? She is 27.
So if a disabled child is on your current policy, and then you're going to a new policy, you sort of go over as a family unit. So we haven't seen people having issues usually with the disabled dependent moving over to the new employer policy, if they've been on it. And I believe specifically on the United Healthcare disabled form, it specifically asks that question, are they currently on your policy? So I think that should not be an issue. But every time you say that, it turns out that it might be one. And if you had more questions on that, you are welcome to contact our center directly for advice. But it should, I'm sorry, it should not be. I don't want to say it shouldn't be a problem, because I always get, it should be doable. Like that.
Thank you, Amy. Thank you.
Next slide. So how does SSI affect insurance? So as I mentioned, in most states, the Medicaid is automatic, but I know definitely it's not for Connecticut or New Hampshire, but it is certainly for New York. And I know there's somebody here from California. That doesn't mean you have to drop your private insurance, but we have a lot of people who end up, they get this Mass Health, they don't know what to do. They call Mass Health and they're saying, oh, well, you have Mass Health now, you have to drop your private insurance, or you should, but we don't recommend that you do that. However, what they don't tell you, even if on the Social Security form you fill out that your kid has private insurance or not, there's nothing that tells Mass Health that you have this other insurance. And, the Mass Health system is quite complex, and there's different programs and policies for people where Mass Health is their primary insurance. And when you have other private insurance, Mass Health is your secondary insurance. So they need to be notified of the private insurance. And it's not too hard to notify them. It's just, one more little form, or you can even do it by phone, but you have to tell them that, and nobody tells you that. So if you're dealing with transition issues and your child's 18, 19, and you get through applying for Social Security and you finally get that, and then you get Mass Health, like, how's a family supposed to know that they need to go, oh yeah, there's this extra little form I need. So then you get a welcome to Mass Health, and then Mass Health says, oh, you need to pick a plan to, enroll, because Mass Health has ACO networks, and you pick one based on your primary care. And if Mass Health is your insurance, that's fine and it works great. But if you have Mass Health secondary, you're not supposed to pick one of those plans. And so, and if you don't pick one, they just put you in one automatically. So there's all these things that you have to do, and there's nobody that really tells people that. So remember, you can keep a kid on a policy, and remember that if your child gets Mass Health through Social Security or just through Mass Health, and you have other private insurance, you have to let Mass Health. And again, not advertising for our center, but you're certainly welcome to contact our center. And we can help you with that. We can help you with the form. People on our team can actually help get that posted into the Mass Health system. Next, so for Massachusetts people, when you receive Mass Health with Social Security, this is this form. It's called the third-party liability form. That's a fancy name for private insurance. Contact Mass Health, tell them you need to submit that form. We can assist you with that. It can be done online, whatever. Do not enroll in one of these plans if you have private insurance plans. If they assign you to one, it's not the end of the world. You contact them, you say, have Mass Health, and I shouldn't have that. What sometimes happens is, if you don't do this, you get assigned to an ACO plan, and this Mass Health, which is secondary, you go to an appointment and you try to use it to pay the claim, and the provider comes back and says they won't pay the claim because they go to that ACO plan, and the ACO plan is like, we don't pay secondary claims. They go through Mass Health, so you have to do that. And don't drop the private insurance. If we had a nickel for every call we got where people were told to drop their private insurance, we wouldn't have to do fundraising. And then I'm going to talk about Mass Health Premium Assistance, because this is a really, really valuable benefit, and they don't tell you about that either. Next slide. So what is Mass Health Premium Assistance? If anybody knows about this, has experience, and wants to type in the chat, I'd love to hear that. But when the ACA came about and we had the Health Connector and these exchanges, there were lots of, and there are lots of subsidies and different ways to make insurance affordable for people. But Mass Health Premium Assistance is a different program that has been around long before. And it's a program for people who have Mass Health as secondary insurance, and they're in categories of Mass Health that are either Mass Health Standard or Mass Health Common Health, which is the forms that people with disabilities usually have. If you have a different form, Mass Health likely hasn't captured the disability, whatever. So for people with employer-sponsored insurance and Mass Health, premium assistance will, if your policy meets certain requirements, reimburse up to the entire cost of what you pay for your employer insurance. And that up to about, they have a cap of about $1,300 a month. So for families who are paying, you know, $500, $600, $700 a month for employer insurance, and their child has Mass Health as secondary insurance, getting this reimbursed can be a very valuable benefit, particularly, you know, as students are transitioning out of school and services are changing. There may be a lot of unmet needs and other things where that money can come in and be very helpful for that. And the but it's, again, it's a separate benefit that you have to apply for when you have Mass Health. You don't, you know, you get the welcome to Mass Health. First, you have to let them know that you have the employer insurance, and then you have to apply for premium assistance. So Anne said the slides will be sent after the event. And I also sent you 2 fact sheets. One was on keeping a disabled dependent on a parent's policy. And then I had a fact sheet on premium assistance, which has a lot of details about how to apply for it and everything else. Somebody did note that there sounds like there's a lot of people who have been utilizing premium assistance. And I'm going to get to the next slide. So it sounds like many of you are familiar with this. And it is, as I said, it's up to $1,300. It is per member, and there's someone here who is on COBRA and with 2 children has been able to get double that benefit, which is really good. Can we go to the next slide? So there are several stipulations. The disabled person has to live with the policyholder. But if you have a student who's at a residential school or boarding school, they are considered living with you. If you have an adult who is living maybe in an apartment separately on their own, then they wouldn't be eligible. And then where we see that sometimes coming in is if the employer insurance might be carried by a parent who's a non-custodial parent and the person isn't living with them, that's the other situation. As I mentioned in that slide way back with SSDI, people eventually with disabilities, many of them will become eligible for Medicare. If your child, for some reason, is already receiving Medicare, becomes eligible for Medicare, you can't get premium assistance. If you're getting premium assistance and then they get Medicare, they still will have Mass Health, and then they'll have Medicare, and they could still be on a private insurance policy. So they could have all 3, but you can't get premium assistance for the private insurance policy. And then the policies have to meet certain requirements. And the major one, there's someone who mentioned it does have to be a group policy. So there's somebody that has a self-employed person that isn't able to get that. And, you know, some self-employed people are able to purchase plans that are group plans, even if it's like a group of 1. But if someone is, like, say, purchasing a policy through the Health Connector or a direct buy policy from an insurance company, then you can't do that. And then we're seeing in Massachusetts, there are limits on, you know, the deductibles, and they raise them periodically, but they often always seem to be like 1 step behind where the insurance premiums are. So currently in Massachusetts, the maximum amount is $2,950 deductible individual, and double that, which is $5,900 for a family, their deductible. And we unfortunately see policies that are $3,000 and $6,000. that are just over that limit. So what we advise people to do is when there is a open enrollment coming up, if you're thinking of applying for premium assistance or you have premium assistance, you can reach out to premium assistance and ask them to help you, look at the policies or make sure that the policy you choose is going to be eligible for premium assistance before you do that. And as I mentioned, this is available in 38 states, including New York and I believe California, and some others. I believe Connecticut is not. Looking at the ones, but there's a website here which will tell you which states have premium assistance.
Amy, quick question about can one decline Medicare to remain eligible for premium assistance? Would that make sense?
It would make sense, but you can't decline Medicare.
Okay. And if the plan is a self-funded plan versus insured plan, does it matter to get premium assistance? Did I say that right?
No, it can be a self-funded or fully insured plan. Yeah, it just has to make sure the deductibles are under the amounts. Are there more questions? Oh, great. Heather, we need to connect. It sounds like you've got a wealth of knowledge. What I've also heard is that in some states, like particularly New York, where it's available, that even though it's available, they're not as knowledgeable about it as maybe we are in Massachusetts. So I know some parents in New York who've obtained it, but they've really had to kind of navigate it on their own. Their SSI, their developmental services department, some of the other agencies that assist people with disabilities weren't as familiar with premium assistance as we are here. So, and then there, again, similar to the applying to keep your disabled dependent on your policy, you have to apply. Again, it's not a huge thing, but there's a form that the employee fills out, and then there's a form the employer fills out. And then it's about a 30-day process, and it works well. But there's often bumps. So I gave a similar presentation years ago. I'm going to tell this fast. And a dad raised his hand, and he had a daughter who was 25, was seeing a lot of providers that don't take the public insurance that she had, really concerned about keeping her. And the dad had a policy where he was paying a very substantial employer premium for it. And so I was really excited because I could help them. Oftentimes it's someone and the child just turned 26, but I said, you can stay on the policy past 26 and you can get reimbursed for this whole premium that you're applying for. And you're going to see our contact information is at the end of the presentation. And I really, hoped the person would be, at our office, not at our office, but certainly calling us Monday morning to get the help for this. And I didn't hear from them. And it was the old days. It was an in-person presentation. And I had the guy's email because there was a little sign-in sheet, and I almost wanted to reach out, but I didn't. And it's like 3 weeks later. And I was driving down to the Cape where my daughter was at school to see her. And I checked on my little phone, and the guy wrote, I'm like, I'm not sure if you remember me, but he was doing everything right. And he just hit a wall with premium assistance, which happens sometimes. And I'm like, of course I remember you. I was expecting you. Why didn't you call me? We were able to help him get that set up, and he got it all for his kid, and was very grateful. So, so someone has made a comment that similar to premium assistance, there are Medicare savings programs that help for Medicare. I would say it's similar, that it provides some subsidies, but it's a very different animal, just to say that. But there are levels of help within Medicare and within Medicaid. There's something in care, I believe called Extra Help for people with Medicaid for some prescription coverages and other things. But this premium assistance is a slightly unique kind of different animal, but there are a lot of other subsidies and things to be aware of. So thank you for bringing that up. Next slide. Oh, so we are at the end. So the most important slide is how to reach us, which is our phone number and our email address. I'm going to type my email address into the chat. Generally, it's better to go through our center. You know, if you can't tell, I'm passionate about this. I am, but we are a pretty big center. So sometimes I get when the messages come in through those numbers, they get routed in a way that we get back to people, and we're known for getting back to people. Sometimes I get an email at 5:30 on a Friday afternoon, and I plan to get back to them on Monday, and then it's Tuesday, and it's been buried under a zillion other emails. And there is no charge for contacting our center for our assistance, whether you call us once or twice or 10 times. And I just want to give an acknowledgement to our funders, because I joke that if I had a nickel for everyone who ran into a problem with Mass Health, we'd be okay. And we do get funding from Mass Health, but we get funding from these other funders so that we don't have to charge for our services. And then I'm happy to take some more questions.
Thank you, Amy. So Amy, a great idea to put your information in. I certainly refer people to you all the time, and this resource is really important. And cost saving is really important, but also knowing what's out there, because again, you know what you know. So thank you. We encourage more questions. I really love the dialogue tonight. Some of you are experts in your own areas, and you shared some really great information about New Hampshire and Texas, and we thank you so much for that. While we maybe look at some more questions, we're going to go into a couple more slides and tell you about some cool offerings we have at the Transition Center. We have an exciting in-person event in Watertown on May 11th. And we do recognize that in-person is still important for people. And we know that sometimes coming to campus is important. So if you haven't been to campus in a while, or you want to see the Perkins campus, this would be a beautiful day for a half-day event. And we'll have Lydia Sheehy, who is here tonight, talking about benefits. And we will be talking about affordable housing with Doreen Cummings from Mainstay Living. We'll have a conversation at lunch for brainstorming and connectedness in our community. And I will be also speaking about community building and supporting self-care. So that's May 11th. Also, we have May 14th, a really great presentation with Alice Bruhard. Alice's daughter was impacted with a traumatic brain injury in a skiing accident, and mom just took over and became a very well-informed expert on using apps to create a self-determined life. And I will also be sharing executive functioning apps and tools that will help simplify and help with organization and planning. So thank you for that. And this is particularly exciting for me. Everything's exciting, but this one really I'm excited about. The Center for Excellence and Guardianship will be presenting a 4-part series with me 4 Tuesdays in June during a lunchtime conversation. And we'll be talking about self-determination, legal considerations, supported decision-making, which is a wonderful movement and an alternative to full guardianship, the rights of adults who have a full guardian. And now that you're a guardian, what does it mean? So that will be very good. That will be virtual as well. And we have a Facebook page. We're very excited about it. So definitely want you to click on that. And again, these slides will be made available to you so you can connect to them. And one more thing, we do have a one-on-one consultation model that we're providing. It's a pilot, and right now it's free. And I work with families and our team as well on transition topics. So if you have other questions, or you just don't know how to launch, or you really want to talk to an expert around the topic of transition planning, whether you have a young teen or a middle-aged teen, or your adult child is aging out, or beyond, we are available in the Transition Center, and our model is three-pronged. It is consultation, empowerment, and referral. So we welcome you to tap into that free resource as well. Well, we ended early. I really want to thank you all, and I thank you for the messages. Alex Lavoie, who's the director of the Transition Center, just put in our chat box a link for you to click on right now. It is our Transition Center main page, and I think you will find it very useful and enable you to navigate all the programs I just talked about. Amy, a profound thank you for tonight. You did very well in putting it all into 1 hour. Thank you for the professionals. Thank you, Janine, for putting on an amazing slide production. And I hope you all have a wonderful evening.